Okay. So just a few things before we get going then. My name's Don Glanders. I'm the Support Engagement Executive for North Wales for CTA. Very warm welcome to our second Good to Go session as part of our online events programme. So it's great that you've signed up to this one. Please do check out the other ones on our website as well. There are lots of exciting events coming up over the next. For today's session, if we can just ask everyone to be on mute, unless they're contributing, there'll be lots of opportunity to ask questions and contribute a little bit later on. But just while we're going through these slides, just so there's not any background noise, if you can just pop yourself on mute. If you, on the toolbar with all the different options, if you click on participants, there should be an option to raise hand. So when we do come to questions, if you can use that to sort of get my attention, and then I'll bring you into the conversation. We've also got the chat function, so please do introduce yourself, ask any questions as we go. And then there are CTA colleagues in the chat who will be able to answer those questions then, and then we can have more of a conversation about it at the end if needs be. The other thing, just to note, if you want to change your name, if you're sort of the name on your screen has come up a bit weird, then you can, if you scroll over your face, then you should be able to right click and then press rename, and you can change your name, and then we'll know who everyone is then. Just before we get going then, I'll share the results. So hopefully everyone can see the results of the poll there. Apologies for those of you who didn't have an option to tick, but you can see we've got quite a range of different operators here today. So some car schemes, people running on Section 19 permits, and you can see that there are quite a few people here who haven't yet restarted their services, or they've only just restarted some services, and everyone's quite quiet. So hopefully there's some comforts for you there that, you know, everyone's at different stages and everyone's sort of still getting back on their feet. So you're by no means on your own there. So we'll just take those down. So I've got a few slides to go through to start off with, which just covers some of the general things to remember, which are hopefully quite straightforward. Hopefully they're just reminders of things to think about. And then there's some COVID specific things that we'll come on to a little bit later. So very basically then, are your permits still valid is a good place to start. If you haven't been operating for 6 months, or perhaps you've been doing deliveries instead of carrying passengers, so you haven't been using your permits. So just making sure that your permits are still valid. Remember, they last for 5 years. Whenever your bus is operating, you should have your permit displayed on your window, and then you should keep the A4 paper somewhere safe. So you need both parts of it for it to be valid. If it has expired, then you can get your permit from CTA if you're a CTA member. They just cost £11. It's not too much of an issue, but just make sure that you've got them, because they're really important to operate legally. Driver license checks, again, hopefully everyone's quite familiar with these. Driver licenses that expired between February and December were automatically extended for 11 months. But what's important to note for community transport drivers especially is that doesn't include the D1 101 entitlement minibus drivers. So if you've got drivers who are 70 or over, if they are relying on their grandfather rights, if they passed the test before 1997, then their entitlement to drive a minibus is not automatically extended. So they'll still need to have a medical with a doctor. We know that some GP surgeries are starting to do medical appointments again for this kind of thing, but some still aren't. So if your driver can't get a medical done at this point, then unfortunately they're not going to be able to drive if their licenses are expired. But the comforting factor is that they won't lose that indefinitely. So once they can get their medical done, then they'll be able to retrospectively apply for their D1 entitlement. Just a note on insurance. So we know that a lot of people change their insurance policies while their vehicles weren't being used. So if you change your policy to fire and theft, for example, then just making sure that your policies are back to what they should be when you're using your vehicles. Volunteer car drivers, you may have seen that the Association of British Insurers said that there was no need for volunteers to contact their insurance provider if they were helping against coronavirus, but that's going to be reviewed at the end of the month. So any new volunteer drivers that join you will likely have to inform their insurance company in the same way that they usually would. Usually there shouldn't be any extra premiums for that. And remember, there is a list on the ABI website of how the insurance companies like to be informed. So usually it's an email or just a phone call, and it's just going through that process. If you have any doubts about your policy, just make sure that you speak to your insurance provider, make sure that everything's as it should be. Related to that then, if you SORNed your vehicle, if you took it off the road, again, just making sure your insurance policy is correct, renew your vehicle tax, and then as soon as you bring your vehicle back on the road, then you're expected to meet all of the relevant maintenance requirements. Just a quick reminder of what those maintenance requirements are, just so that, because it might have been a while since you last had your vehicle on the road. You should be doing your daily checks, so walk around checks every time the vehicle goes out. Safety inspections, they should be at least every 10 weeks. That's in line with the DVSA's Guide to Maintaining Roadworthiness. So you might have increased the time in between safety inspections while you weren't using your vehicles, or if they were off the road, or if garages were closed. But now that most garages are back open, you should be doing those safety inspections at least every 10 weeks, or as you were before coronavirus. MOTs, there were different extensions given to cars and minibuses throughout coronavirus, depending on the age of the vehicle or when the MOT expired. You will have possibly had a 3, 6, or maybe even a 12-month extension to your MOT. So the best thing to do if you're unsure is just to check online, which is really simple. You just pop in your registration number and it'll tell you when your new expiry date is. Servicing, just in line with your manufacturer's recommendations. And then wheelchair lift inspections, if you've got accessible vehicles, they should be done every 6 months. And remember, that's a legal requirement for those inspections. A note there as well, just to keep records for at least 15 months, passenger lift records for 2 years, especially if you've changed your maintenance schedules throughout coronavirus. Just make sure that you've got a record of what was done and when, just so that if anything was to happen, then you've got that record. That was really, really quick, just because hopefully they're just reminders of things that you know. And we'll just go on to operating some during coronavirus now, which...
Dylan, can I have a question?
Yes, of course.
Do you mind? Can we just go back to the driving license D1 for over 70s?
Yeah.
I applied for my over 70 D1 in March. It expired in May, and I have a medical condition. I've been trying to get through to the DVLA. Eventually, I got through last week, I think it was, by email, and explained all the problems because my case is with their medical department. They sent me an email which said that my license had been extended for 11 months. There was no qualification about not being able to retain my D1. The only thing was qualification was as long as my doctor said that I could continue to drive. Your interpretation was slightly different, I think.
So when you submitted your application, had you had a medical completed?
Correct.
Yeah, so I think that's if you've had a medical completed and the doctor said that it's okay, I think then that's sort of the condition that they want you to meet.
Okay, it's still a bit of a grey area, I think, and the difficulty is getting through to DVLA, but actually their email system seems to work. Letters are hopeless, but email seems to work.
Yeah, I think they are slowly getting better at sort of responding now, because they've got more people back in the office, and they're sort of, because I think they were working remotely and a lot of people were, so I think they are getting to that point now where they're starting to work through that backlog of different queries and things.
Okay, thanks.
Okay, so operating during COVID, what I'm just going to start with is complete a risk assessment, which is probably the most important thing that you need to do before you restart your services. So I think everyone sort of realizes now that you're never going to be able to completely remove the risk. So it's just how you can do everything that you possibly can to minimize it as much as possible. So just a couple of things to bear in mind when you're doing this. Make sure that you involve your drivers, volunteers and passengers. They're the ones that you're trying to keep safe. So make sure you understand sort of what their concerns are, what they perceive as the risks, because a lot of people are interpreting the risks slightly differently. So just make sure that you're aware of how they're feeling and that they're comfortable with the measures that you're putting in place. Keep it updated. So this isn't something that you should just do before you restart and then completely forget about it. So it should be a document that sort of evolves over time. We know that guidance is constantly changing. So make sure that you keep it up to date. And use it to inform your policies and procedures. So how you want your drivers to interact with passengers, how your face covering policy, how often you want cleaning to be done, should all come back to your risk assessment. So make sure that it is a really useful document and it's not just a tick box exercise that you're doing. And then check out examples from CTA members on our website. So we've got a template that we pulled together from members who were kind enough to share their risk assessments with us. And then we've also got copies of different groups and their risk assessments on our website. So please do check them out. If you're CTA members, then you can log into the members area and you'll find loads of different examples from different groups, which should hopefully help you go through this process. Okay, on to the $1 million question, which I think has come up a lot over the last few weeks. How many people can I carry on my minibus? And unfortunately, there's no right or wrong answer to this. I'm just going to pop up another poll just to see how people have been approaching this. If you haven't yet restarted, don't worry about answering this, but if you have, if you just want to give us a little indication of where you're at, or how you're sort of approaching this, or if you're at the stage of thinking about restarting, then what you think it's likely.
Dylan, I can't submit. I couldn't submit last time.
Oh.
Is it because I didn't put anything in number 1 because we don't have minibuses?
Oh, I wonder if it is, yeah.
You've got to put an answer in before you can submit.
Oh, sorry.
You have to put an answer in before it will allow you to submit.
All right, I'll put an answer, but we don't actually do minibuses.
We're restricting additional passengers. So we're trying to get the volunteer service back up and running, but we're going to say wheelchair passenger only unless they absolutely have to travel with one other, and then they will sit diagonally behind the driver furthest away. But that's as far as we've got, really.
So I'll just share these results. They might be a bit skewed because of people having to answer things that they're not actually doing. Apologies about that. But it just gives a general idea. Minibuses around about the 4 to 6 mark. Cars, mostly 1. I know that cars, some people might if they're travelling with a carer or a member of the same household, if it's absolutely necessary, some people might be doing that. But with minibuses, you can see that we're around that 4 to 6 mark. So what that's really showing is that capacity is going to be reduced. No matter what size your vehicle is, the capacity on your vehicle is likely to be reduced. So that might involve removing seats or blocking off seats. And it comes down to these rules about social distancing. So following the government guidance, at least 1 metre plus or 2 metres if you're in Wales should be maintained between passengers on vehicles. And the plus there means measures such as the use of face coverings, ventilation, enhanced cleaning, so those extra things that you're doing to keep people safe. So at least 1 metre plus, 2 metres in Wales. So inevitably, that's how you're gonna end up with a limited capacity. Just to note on members of the same household, extended household, support bubbles, there's lots of different names for these sorts of things that have been brought in. They don't need to social distance, but then if you're piling on people onto a minibus from the same household, just think of the impact of that on other passengers or the driver, and just be aware of local restrictions that affect that as well. Local restrictions are popping up everywhere at the moment, and they're all slightly different. But in Wales, for example, where I live, they've removed the extended household rules, so you can no longer form an extended household. So just being aware of things like that, and make sure that you're following those rules. Another sort of question that's come up a lot: should I install a protective screen? I've got a poll for this as well.
No, we've run out. I'm going up to get a box of them later on, and I'll put some more masks out.
You can see that.
Right, we've run out basically. I'm going up the shop on the way out.
So again, there's no sort of right or wrong answer to this. There are some pros and there are some cons. If you're a car scheme and you use volunteers in their own vehicles, then you're probably unlikely to do this.
I'll go with it. And I've got the little ramp as well sorted out.
Yeah, those results. So some people have said yes, a lot of people said no. So no, we've got a lot of car schemes here, so they perhaps won't have, and then some people thinking about it. If you've said yes, it'd be great if you could just pop in the chat where you got it installed or which manufacturer you used. It'd be great if you could give an idea of cost as well. That might be really useful to some other people. Just some things to consider when you sort of decide in your approach to this. Will the screen be professionally installed, made of high quality material? If you're going to do this, you want to make sure that you're doing it right and it's going to actually make a difference. So you want to get it installed professionally. Make sure that it's not some flimsy piece of plastic that isn't actually going to add any protection. Will it change the structure of the vehicle, the driver's ability to move their seat? We've heard of sort of MOTs being failed because the driver can no longer move their seat. If you're changing the structure of the vehicle, then you're going to need to probably inform your insurance company. Depending on the license you operate under, you might need to inform the DVSA as well. So just being aware of that. Will it affect the ventilation of the vehicle? We know some vehicles, the only windows are in the front of the vehicle, so if you're blocking that off, then you're getting rid of all the ventilation in the rest of the vehicle for your passengers, which might be a concern. A big one for community transport, especially with the nature of the passengers that you're taking, will the driver still be able to communicate with passengers? If everyone's already wearing masks, then it could make it more difficult as well. And just at the bottom there isn't any sort of solid evidence about how effective these screens are, just because there are so many different types, so many different materials. but they can help to build confidence. So if you've got nervous passengers, nervous drivers, it might be something that they ask for or ask you to consider, just because it can add that confidence. On to cleaning then. Which cleaning product should I use? We know that cleaning is going to be really, really important for everyone, keeping vehicles as clean as possible. So using disinfectant wipes and solutions, bleach solutions, and just wiping everything down as much as possible, really. Fogging and misting products. A lot of people have gone down the route of purchasing sort of fogging machines, misting machines. And I'm going to just launch a poll on that. Because this is something that has come up quite a lot again. I've put do your research there, just because there are so many different types of products. They can be quite costly, so it's just making sure that you're getting good value, and that the thing that you're purchasing is actually effective against the virus. So we've got a few yeses there, a few no's as well, a couple of people thinking about it. If you said yes to that, again, it'd be great if you could pop in the chat the product that you're using. Again, maybe an idea of cost and how you're finding it. There we go. So just on cleaning, just to consider those touch points, so handrails, door handles, seat belts, everywhere where there's going to be lots of contact places where the virus could gather, making sure you concentrate your efforts on those areas. Certainly after every journey you want to be wiping those down, and then perhaps at the end of the day more thorough clean of the vehicle. Being mindful of damaging or discolouring materials. I've mentioned bleach solutions there, so just being aware that you using those sorts of materials could damage or discolour the materials on your seats and in your vehicle. Disposal, so just making sure that you've got bins and bin bags available on your vehicle and at your depot to get rid of these cleaning products properly, and then being really clear on who is responsible and how often, which again will come back to your risk assessment, making sure that if your driver is responsible, that they know when they should be cleaning, how often, and what they should be doing. PPE, I think everyone's sort of getting used to wearing face coverings now. All passengers should be asked to wear a face covering. Remember that some people will be exempt, and one thing that you should bear in mind is how you will handle that. So if someone doesn't want to wear them, just being clear on how you will approach that. Taking sort of a blanket, no mask, no travel rule might not be the best approach, but you've got to consider how other passengers on the bus or on the vehicle or the driver feels if a passenger is not wearing a face covering. So perhaps we know of some people asking them to wear face visors instead, and just taking that more of a conversational approach of how you can overcome that, because again you don't want to go down the route necessarily of refusing travel point blank. So just considering how you would overcome that. Face coverings while driving. Drivers don't have to wear a face covering, but they might choose to. But just be aware, is it likely to cause a distraction, affect their visibility? Especially if they wear glasses, for example, we know that they're wearing face covering and glasses, you can end up misting up. So if they are going to, just make sure that it's not causing any sort of distraction to their driving. Extra PPE should be worn when providing physical assistance or securing a wheelchair. This is, again, something that concerns a lot of people. If you're having to get really up close with someone, if you're leaning right over them to secure a wheelchair. So it's just, again, being really clear in your risk assessment about how that should be approached. So making sure that extra PPE is available, and just making sure that everyone's comfortable with what they're doing. So if you've got a driver who's really uncomfortable getting that close to someone, then perhaps, you know, that's a conversation to have with the passenger. But again, a blanket, so we will not carry a wheelchair, might not be helpful in this situation. It's sort of taking that case-by-case approach, doing your risk assessment, making sure that if you are going to do it, that all of the appropriate PPE is in place. Just a note on taking bookings. So just double checking when you take a booking and before the passenger actually enters the vehicle that they haven't got any symptoms, they haven't had a positive test, or no one in their household has had a positive test. So just double checking that before they come onto the vehicle. I would hope that passengers would be, and drivers as well, before they come in, would be really transparent with that sort of information. And then just being really aware of local restrictions, which seem to be coming in all the time. So especially if you're crossing county borders, some of the some of the local lockdowns are saying not to go out of county, but in some cases that's unavoidable. So just making sure that you're aware of what restrictions are in place, and that, the journeys that you're making are sort of a reasonable excuse is the term that they use quite often in the guidance. So just being aware of what is going on in your area. And finally then, just to communicate with passengers, so just let them know that what you're doing to keep them safe. A lot of this is going to come down to confidence, building that confidence back up to go out again. So, letting them know that you're doing everything you can to keep them safe. Following that government guidance of washing hands as much as possible, making sure there's lots of sanitizer available on your vehicles, wearing face coverings as much as possible, and keeping that social distance. There are some really good examples, and we can share the links of community transport groups who have done videos of what they've put in place, and really nice sort of visuals that can be shared with passengers, just to sort of take them through what to expect when they get on the vehicle. Because like I said, building that confidence back up to get people to go out again is going to be really, really important. Okay, so that's the sort of whistle-stop tour of some of the things to consider. I appreciate that I've gone through that really quickly, but again, you'll get the slides and a copy of the recording. So just to open it up now to any sort of questions or anything that you want to share, any of the experiences that you've had. You want to use the raise your hand function or just wave at me.
Hi, Dylan.
Maxine, yep.
So we did our first, we haven't got the volunteer service, as I said, and yesterday we did the first volunteer training session, also with our office staff, about infection prevention and control PPE wearing. And it went really well, I'm pleased to say. However, at the end, one driver told me they were about to be put into the highly vulnerable category, would it be all right for them still to drive? And another driver said they can't possibly wear a face mask. So I've had to stand two drivers down before we've even started. And they want to come back, but as an organisation, we've had to take the decision that we're not confident with them in that position. Do you think we've done the right thing? I think we have. They're very upset.
Yeah, I think we've heard a lot about, you know, drivers in that high risk category sort of banging at the door and they can't wait to get back, and it is really difficult because on one hand it's, you know, they're saying, well, it's my decision, this is what I want to do, but then as you've done, Maxine, you've got a duty of care to those drivers, and you want to protect them. Has anyone else sort of had that or taken an approach to older drivers coming back or more vulnerable drivers that wants to share? Derek?
Yes, I mean, we actually check our clients before they board the minibus. I mean, we have a handheld, one of these infrared thermometers, and we ask them how they're feeling before they come out of their house, and then before they board the minibus, the driver will zap them with a thermometer, which is recorded. So, I mean, that's another step to ensure people are safe.
Yeah, definitely. Thank you.
If they sign a disclaimer, does that not give them the right to make the choice themselves?
Yeah, we've thought about all of that, and I'm being really selfish here because I actually don't want to have to deal with it. So the whole thing is, it's prevention. It's about prevention here. And we are putting all these things in place. We've done the PPE training. We've explained, if you do this, this is the safest you're going to be. We've obviously got to trust that they're going to listen and do what we've said in the way that we've shown them how to do it. But if you're in a highly vulnerable category, you're not prepared to wear a mask yourself. It's not he's not prepared. He has a problem with it. I've suggested take a couple of masks, just practice wearing them at home. Just put them on as we've shown you. See if you can see how you feel at home, because you're completely comfortable in your own environment. And so he's going to try that. But I can't remember what I was going to say now. What was the other thing? Sorry.
One of our drivers, Maxine, he didn't like wearing a mask, and he's bought these. They look like a snood, but they're impregnated or something. They're really safe. They're medically safe, and he just pulls it up, and he says it's really comfortable. His mask was hurting his ears, and he has a thing he pulls up, and it's really comfortable. So could you not get something like that? I can find out off the driver what it is and where he got it from, if you like.
Well, the thing is, I mean, we're providing type 2 masks, which if worn and used correctly will afford the driver protection as well, as opposed to them, you know, because the whole thing about wearing masks is protecting other people, isn't it? It's not about protecting yourself.
Stuart, do you want to come in on this?
Yeah, the pull-up snood masks, they have an impregnated chemical on the inside, and I've worn them a few times and ended up with face, like burning face and sore throat. So I think somebody told me wash them 3 times. They are more comfortable than the full face mask and stuck around your ears and all that sort of thing, but they can cause an irritation on your skin. Okay.
Brilliant. Thank you, Stuart.
My view is we've got to be quite clear about our stance on this. And there are people, as we know, who are given to slightly bending the rules to their own specification. And because I've got quite a lot of responsibility for, you know, our drivers, our personnel here, and all the passengers, I think we've got to make sure. I just feel very, very strongly we've got to get it right, and especially where we are. We're not in lockdown, but we've got you know, increasing cases. In fact, my son's just been sent home from school to isolate, although we don't have to, but he has to isolate now. So you know, it's very real.
Yeah, Stuart's got it on. That's what my driver's got, and he says it's really comfortable.
You look like
Answer, Maxine. If somebody doesn't feel comfortable wearing a mask, that is an answer.
So this is good, but you've got to wash it 2 or 3 times at least to get the chemicals out of it. The other thing that we're going to wear is an actual shield. So there's a shield that can fit on that comes underneath the chin.
Yeah.
That would also be a good protector. And I think they were 25 quid for 12 shields, and they fit on your glasses, and it's supposed to stop you steaming up as well.
Yeah, we've got the shields as well. But I mean, I was told by a healthcare professional that the shields actually don't give any protection whatsoever.
Probably not.
You
We're
know,
both.
I know. We're not trying to be awkward about this. We're just trying to limit our liability and protect our personnel and our passengers. That's it. So I think we've got to just be strict. And actually, one of the main places that our passengers are wanting to go is actually closed now for 14 days because someone's tested positive. So we're having a bit of a spiky start, and we haven't even turned a wheel.
Thanks for sharing that, Maxine. Angela, I saw you popped in the chat. Did you want to come in?
Yeah, I was just going to say we've been up and running since July, and we are on a slow and steady build. But when it comes to the numbers on the bus, we've got 14-seated minibuses, and we are going with the fact that the government is saying a bubble of 6. So we only put 5 passengers on with the driver, and you are right, we're less fuel efficient because we're repeating journeys. And with the face mask thing, we were told that the screen visors are okay. So, because we have members that can't wear the masks, but then if they haven't got a mask on, you get other members on the bus that are nervous. So we sort of tried to go with at least the mask is there. If you sneeze, it stops anything. So, but yeah, I mean, it is, and we're still on a learning curve. We're still changing things every time. We haven't done the plastic shields because we just feel it sort of is intrusive between the relationship with the driver and the passenger. We're trying to build their confidence, not scare them.
Yeah, Angela, you know, we my thing is, if the driver is correctly wearing their face mask, they will be protected. So we do, I remember what I was going to say now. We always used to ring the passengers the day before their journey to just remind them, confirm them what was happening. We're now going to use that phone call as verbal COVID screening. So we've got a thing set up. So we're going to go through a list of questions the day before their journey, just to confirm and explain it to them. We'll explain it fully when we take the booking from them. And the drivers will also have a few spare in a sealed bag, masks and visors, just in case the passenger hasn't got one. But we're going to try to communicate this all beforehand, so we're all prepared as much as we can be. So even if the passenger, for medical reasons, can't wear a face mask and they can wear a visor, our driver, my point is that our driver has to be the best protected that they can be. Yeah. And that is by wearing a type 2 face mask correctly. And I'm not going to budge on that.
Again, I agree with what you're saying. I think everybody's working on their own sort of standard of what they think is the safest. But, you know, it's sod's law. We all do something and then the government will go, no, that's wrong. But I mean, I'm not only sort of sat here, I am one of the drivers, so I am out face to face with them. And I have to say, most of our passengers have picked the idea up. The first couple of weeks, we were like, this, and now they'll tell us. And we have a bottle of sanitizer taped to the handrails in the bus. They automatically now come on and put that on. We do designated seats in, whichever seat you went in, you come back in. And we try to send one bus there and back. If we have to put another group in the middle, then that bus gets completely wiped down and we get the next set of passengers to sit on the opposite seats.
You're doing really well. That's all really good.
So, but you know, as well, it's giving your members that bit of, you know, once you've told them once or twice, they pick up, it becomes a habit. Yeah. So they're pretty good on it themselves. But I personally drive with my mask on, pair of gloves on. And when somebody, if I do the shopping run, I'm aware that I've handled so many, say, shopping trolleys. So the gloves come off and new gloves go on, because we don't want to keep contaminating anybody else. And we try to reinforce that with the passengers. When you're in that shop, you can come out with it, so you need to protect us as well. And they do pick it up, and at the moment they're just grateful to be out. That's our biggest thing. They are grateful to be out. We've seen such a loss in confidence, such a loss in physical ability, that, you know, we're staying online as long as we can.
And to see a real life person. I mean, I've got really excited about seeing people. As I've said to you, in the drop-in centres, even people I don't particularly like, which is a bit worrying, but I think we're all, you know, desperate for real life people, aren't we?
Yeah, and the hardest thing is saying to them, you know, we can't touch you.
Yeah.
Can I just seek clarification, because I think there's a very important point being raised and discussed here. The difference between face visors and face coverings is, I think, essential. My understanding of the regulations is that you must wear a face covering. You can wear a visor, but you must wear a face covering. So just wearing a face visor is not acceptable. Now, I think that's my understanding, and I think that needs clarification. A face visor will not protect you or the others around you from, as someone said, a sneeze. It will not stop droplets. It will not stop aerosols. So I think that is important. The other thing I would raise, and this is from my professional career within the NHS, is the use of gloves. If you observe people wearing gloves, as I have done on many occasions, you will see them scratching their noses, picking their ears or whatever, because you cannot feel if anything falls on them. It also gives you a false sense of security. If you're not wearing gloves and you sanitize your hands regularly, then in my opinion, that's far better. And I always used to say to my colleagues at work, and I was the safety officer at work, I always used to say to them, if you see me wearing gloves, you know we have a big problem. And so I just raised that. I mean, I'm not going to stop people wearing gloves if they want to wear gloves, but just observe what people do naturally with their hands. They wave them around, they touch themselves, etc. That doesn't stop with gloves. And so wearing gloves, to my mind, gives a false sense of security.
Brilliant.
Face coverings, let's not call them masks, but face coverings and visors needs clarification. And maybe I can suggest that the CTA actually delves into their wherever archives and looks at the regulations and actually gives a definitive answer. You know, what is required, because my understanding is that face coverings must be worn unless you've got an exception. Now, with my organisation, I was rung up a few weeks ago by one of the drivers saying, look, I've got someone who says they're exempt from wearing a face mask, can they cut on the minibus? And I thought about it for about 10 seconds and said, unfortunately, no, because, you know, that will put other people at some risk, and it will also make other people uncomfortable. So, but yeah.
Yeah, thank you, Derek. That's really good insight. Can I go to Alison? I can see you've got your hand up, and then to Stuart after that.
Thank you. Thanks, Dylan. I work for a charity that supports people with visual impairment, and ordinarily we run 9 day groups a week. So we go out in our own minibuses and bring up to 13 people each back on each minibus. Now we've been carrying on offering services to these people throughout lockdowns. We've been doing welfare calls, we've been helping with shopping. More recently, we got some funding to get some technology, and we've been connecting people via FaceTime and Zoom. So one driver would go to a service user's house and another would go to another's, and actually get them connected so that they're not so isolated. And obviously we've risk assessed that and put procedures in place for all of that. But we're getting to the point now where, to my mind, the balance is shifting between what's right for those people from protecting them from a COVID point of view and what's right for protecting their mental well-being. A lot of our service users are elderly, and with the added complication of their visual impairment, they can't go out, they're not going out, and actually I'm finding that a lot of them are starting to suffer mentally. So I'm now looking at trying to bring some of those people back in very, very small groups, and I was thinking about 4 at a time. I just wondered if anybody here today ran a service like that and had tried to do anything like that and had any tips about how to do that as safely as possible.
Does anyone want to come in on that? Sue?
We only take people because we're a volunteer car scheme, but there's an organisation in Stockport called Wolfview House that take people with visual impairments. We always used to take people to groups, and that had to stop, but that started back again at the beginning of September. And we're taking people to small groups. So it might be worth getting in touch with Wolfview House in Stockport and see how they've done it.
What are they called?
Wolfview House, WALTHEW.
Brilliant, thank you.
And they're taking people every day, and it's people that have visual impairments mostly, because the mental health was suffering really badly. So we're now helping to get them people there in the cars, which is what we do for anyway. And
how many are you taking in the car? One per car?
At the time, unless they live in the same house.
Yeah, okay. Because the thing with visual impairment is, I mean, they need a guiding arm, so there's that added.
Well, the drivers help.
Yeah. Well, we would do that normally, and I've looked at getting some of those like plastic sleeves that cover your arm, so that when you are guiding, there's that extra layer of protection. Thank you, Sue. I'll give them a ring and see what they can.
Yeah. The drivers sanitise their hands before they help them, and then they sanitise their hands afterwards. That's the main thing, and the clients are sanitising their hands before they get in the cars. So that's a good enough level of protection, I would have thought.
Yeah, and we've got some. There's some guidance from the government now about that you can guide a visually impaired person. So we've got that guidance as well. Thank you.
Patricia, do you want to come in? I can see your hand.
Yeah, I don't have any particular comments on the conversation we've just had, but I would like to know how are people approaching passengers who they know have had COVID? In terms of allowing them back to use the service.
Has anyone had that experience yet? Or?
We didn't have a passenger, but we had one of our self-drivers who come and drive their own family and friends. And so we asked them for the specific dates of when they had it, and obviously how long ago it was and how bad it was, and we take a decision in the office whether we think, because what we're told is that you're only contagious for the first 5 days.
Yeah.
So presumably, it will be slightly different for passengers, because he's driving the bus with his own person in the bus, and they are supposed to sanitize it afterwards, cleaning it, and then generally our vehicles are stood down because we're so quiet. So from that point of view, we felt confident that that was fine, and they've told us, you see, the thing is we're accepting that everyone's telling us the truth, aren't we? We're trusting that people are being honest. So if a passenger said they'd had it, we would look at it exactly the same. We would just look at the dates and take it from there. And you know,
I mean that's what I've done, because we've had a passenger who's had COVID. Well, we've had several, but I mean we've had one who's had it quite recently. And I did exactly the same thing. I looked at the dates. I looked at the periods that you are required to self-isolate. So if it's you that's got it, you are required to self-isolate for at least 10 days. But the key questions to me in terms of letting this person back to use the service again was, well, was he still infectious? So I was asking questions like, well, have you still got a temperature? Have you got a cough? Have you got a sense of taste? You know, and just to sort of try and make sure that he wasn't showing any signs of it anymore, because, you know, it's quite difficult because people can be over the virus, but with this sort of long tail off of fatigue and exhaustion. And
I don't think they're contagious in that time, are they?
But no, they're not. I don't think they're contagious, and I think that's the point. No. Is that you know, they might still be, you know, not quite right, but they're not contagious. So I think from our point of view, it's quite difficult to say, well, we're not, you know, particularly because what our scheme does is takes people to health and wellbeing related appointments. It's very difficult for us to say, well, we're not going to take you to your hospital appointment.
I know, we just have the screening. We just have a form that the self-drivers actually complete and email back to us, signing it, to confirm, and we get a complete list of all the passengers that are travelling in the vehicle with them, because it might be, you know, the driver might be going with their wheelchair passenger plus 1 or 2 family members, which is fine because they're in one bubble in the vehicle. There's none of our personnel in there. And the volunteer passengers, when we get them back, it will be a verbal screening. And actually, having been to a medical appointment myself during this time, and multiple with my father's, and looked at the screening that all the medical settings are doing, I've taken that to base, you know, how we're doing ours as well. So I hope they don't mind that I've copied them, but hopefully it will keep everyone a bit safer.
Yeah.
Thank you both. I'm just conscious we're running out of time, and I want to bring Stuart in because I think he's had his hand up before.
Yeah. Okay, then. Just 2 things on that. The lady before was saying about getting people to sign something. Is there an actual exemption declaration form? I'm just thinking more about, like, when I'm doing MIDAS training and I've got delegates that are going to come on the, you know, for the driving assessment. Is there something that the CTA have got to say, right, you know, you confirm that you know, you've not had it in the last however many days, or you've had it, are you now clear and stuff? Is there an exemption, you know, form that people are using at the moment that could, you know, be spread around us all? Not the virus, obviously, but the form. And then just the very last point that I wanted to make was, you were talking about the maintenance, and, you know, if your vehicle hasn't been run for a while, you really should be running the vehicle at least once a week, whether you're using it or not. Our you know, mechanic maintenance guy, he said, well, if you don't run it, your brakes will seize up, your diesel filter pump will seize up, and you'll end up with £800 or £900 worth of a bill to repair all the mechanics. So whether you shouldn't really have taken it off the road, because you should have been running it once a week, at least, even if it wasn't being used for normal CT duties. So that was the advice that a mechanic gave us. So if you're not using it, plus the fact the battery will have gone flat anyway.
Yeah, thanks. I think that was the reason why a lot of people decided not to SORN their vehicles, just that, so they could carry on running it, you know, like you say, once a week, just to keep everything ticking along. In terms of a disclaimer, there is an example from, I think it's from Royston and District, one of our members. That's in the risk assessments or resources on our website. There's an example in there of a disclaimer, so please do check that out on our website. Has anyone got any final concluding thoughts? We've got 1 minute left.
I don't think that disclaimer says that whether you've had COVID or, I don't think it's related that way. It's more that you've not got any health reasons why you can't drive. I don't think it's what Stuart was saying.
Right. Yeah, it might be, that could be something that we look at then, Stuart, to see if we can adapt that and sort of put something along those lines together. I'll just quickly share my screen just to finish off. There we go. So thank you very much, everyone, for coming today. I hope it's been helpful. So following this session, you'll receive a feedback form. So please do take the time to fill that out. It should just take 1 or 2 minutes. There's a list of our upcoming events there. So please do sign up to more of them. Some really interesting ones coming up. Remember to check out our members area. If you're not a member, consider joining us, because there's loads of different resources in our members area now, around funding, around risk assessments, around volunteers. So please do check them out. Like I said, you'll receive a copy of the slides and the recording following this event. And if there's any questions at all, remember you can always email advice@ctauk.org. And we are also continuing to hold our weekly advice drop-ins. So you can email advice@ctauk.org to sign up to those if you want to join us on a Friday, 11 till 12, for a more informal chat about any concerns that you have. But that is it for this morning. Thank you very, very much for joining. I hope it's been useful, and I hope to see you at another one of our events soon.